Hi, everyone, and welcome. We will start in about 30 seconds. We're just waiting for everyone to join. Okay, great. All right, I will kick us off then. So, hello, everyone, and welcome to today's event on enhancing patient decision-making through cancer education as we look to launch our ACS Equipped initiative for global cancer patient and caregiver education. So for those of you who don't know me, my name is Jenna de St. Jour. I'm a program manager for global patient support at the American Cancer Society, and I'll be your host for today's event. Next slide, please. So before we get into the event, I have a few housekeeping items. The Zoom privacy policy is available on this slide via the link. We are recording this webinar, and we will share the recording after the event with all people who have registered for the webinar. Please do not share any personal, sensitive, or identifying information on any patient or anyone else during this session. If you have any questions, we invite you to post them in the Q&A section section on the lower menu bar, as you can see on the slide here. And if we run out of time to respond to all questions, we will look to share an FAQ after the webinar. So the chat is open in case you want to share your comments and reactions with the presenters and participants. And as always, you can always share your reactions by clicking the React button. And then finally, if you want to turn on closed captioning, please click the Show Captions button. Okay, let's get started. So today, we will give a brief introduction on ACS and our global work, and then we will dive into global cancer patient and caregiver education, including an intro to the ACS Equipped initiative. We'll then give an overview of the global equipped resources that are being launched today, and then we'll move into a panel discussion with some of our key partners from Kenya and Uganda who have been implementing cancer patient and caregiver education materials in their settings. And then we'll briefly describe or cover the application process on how your organization can gain access to the equipped resources. And then finally, we'll open the session up to any questions from the audience before we wrap up. I'll now hand it over to Christy McComb to take us through our global work.
All right. Hello, everyone. Thank you, Jenna. My name is Christy McComb, and I'm the Managing Director of Global Patient Support, and I am so delighted to be with you all today. Thanks for joining us. So to get started, I would like to introduce the American Cancer Society and our global work for those of you who may be new to us. And if you are, thanks again for joining us. The American Cancer Society is a leading cancer-fighting organization with a vision to end cancer as we know it for everyone. We have a three-pronged approach through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. Next slide, please. The American Cancer Society exists because the burden of cancer is unacceptably high, and the global burden of cancer is expected to almost double in the next 3 decades, with low and middle income countries, or LMICs, shouldering most of this burden, both today and into the future. Next slide, please. Within our Global Cancer Support Department, we have initiatives that strengthen prevention, patient support, and health systems through global collaboration and evidence-based programs. And we currently reach partners in more than 80 countries with our programs, initiatives, and other collaborations. Next slide, please. So today we're going to introduce a program that's tied to the work of the team that I lead, Global Patient Support. And our team's work is focused on removing barriers to care, to timely diagnosis and treatment, as well as to improve the patient experience. So we promote and drive the delivery of patient-centered care through two key areas: patient navigation and patient and caregiver education. And our work really straddles both the healthcare facility setting as well as community settings, because patients must move through all of these environments and settings on their cancer journey, and they can really benefit from strategic support at all steps along the way. And my team also ensures the delivery of patient-centered care through our work to strengthen the cancer civil society sector. Civil society organizations, or CSOs, play a vital role in ensuring that the patient voice and the patient experience are at the heart of the delivery of cancer prevention, care, and treatment. CSOs deliver vital patient support services, advocate for the right resources to be deployed where needed, and they hold governments accountable in the policy making and budget making process. And our team's work began around 10 years ago in East Africa and has grown steadily ever since to support a wide variety of partners around the world. And as we grow, we continue to learn and adapt our approaches, as you'll discover today with the EQUIPPED initiative. Next slide, please. So, to appreciate what EQUIPPED is all about, it's really important to understand why effective education is so important for individuals facing cancer and the loved ones who support them. Next slide. A cancer diagnosis brings a mountain of questions, concerns, fears, and uncertainties, and offering support to cancer patients often means answering questions and providing information. And in many cases, it also means addressing persistent myths and stigma that get in the way of timely diagnosis and treatment. And this is one of our main roles as the American Cancer Society. We are a primary source of reliable, expert-vetted cancer information. We offer 24/7 support via trained specialists through our online resources and the support communities that we facilitate for patients and caregivers. And everything we do is aimed at empowering patients facing cancer to understand what's before them and to make the best decisions for themselves and their families during these very challenging times. Next slide. So today we are pleased to officially launch the global suite of resources of the EQUIPPED initiative. EQUIPPED stands for Enabling Quality Interactions Between Providers and Patients Through Education Delivery. And it is a capacity development program to improve global cancer education for patients and caregivers in LMICs and other relevant settings. And we want to support our partners to deliver effective cancer education that is people-centered, scientifically accurate, culturally and linguistically appropriate, and education that enhances patients' understanding and decision-making through treatment. So the EQUIPPED initiative, through our collaborators, extends ACS's reach as a provider of accurate cancer information to people around the world. Next slide. So I'd like to give a brief history lesson on the global cancer education materials that we are promoting today with this launch. So we began the development of cancer education materials for LMIC audiences approximately 10 years ago with our partners in East Africa. Initially, our intention was to develop cancer prevention materials, but the resounding feedback we received during our engagement with government and civil society stakeholders was that many people didn't even know what cancer was, let alone how to prevent it. We also came to understand that though individuals were being diagnosed and treated for cancer every day, many were not being told what disease they had, nor provided with much of the necessary and beneficial information and counseling that may help them make the best decisions regarding their treatment. So we embarked on a process to understand what materials for newly diagnosed patients existed in each of these countries, as well as to assess what materials the American Cancer Society had that could be adapted to different settings. As noted earlier, our library of materials contains a wealth of information, but our materials required extensive adaptation to be relevant in other contexts. So in 2015, 2016, in collaboration with Johns Hopkins Center for Communications Programs, we followed a comprehensive process in each of the three countries, Ethiopia, Kenya, and Uganda, where CCP staff reviewed ACS materials, conducted a desk review of available resources in each country, and met with stakeholders like the Ministry of Health, providers, patients, and caregivers in each country to understand their views on what was needed, including conducting formative assessments. And at the time, 2 ACS materials were identified for adaptation. After Diagnosis, which is a resource for patients, and Listen with Your Heart, a resource for caregivers, the images you see here on the left. And from that, country-specific suites were developed for each country in English and at least one main national language. These materials are known as Cancer Education Materials for Patients and Caregivers, or CEMPC. So you may hear our panelists later today refer to CEMPC or Kenya CEMPC, just to give you a heads up. And the materials on the right that you see have been used ever since and are widely distributed in hard copy across the 3 countries. Next slide, please. So these country-specific materials pave the way for our global suite of cancer education materials. As we were getting ready to launch our Beacon Global Oncology Navigation Toolkit 4 years ago, we knew that when we shared samples of the East African materials as a key resource for patient navigators, that there would be institutions and organizations needing similar resources. But we also knew that these materials were too specific to those settings. But we also knew that the challenge of having available, effective materials was not unique to East Africa. So we wanted to devise a way to scale the availability and the use of these kinds of resources for patients and caregivers without sacrificing quality. We had also learned a lot in supporting our partners in East Africa over the years, and we applied those lessons to the development of these materials. So we engaged Hesperian Health Guides in this adaptation process. Hesperian is a nonprofit organization that creates and distributes simple, illustrated health education materials in many languages for underserved communities globally, empowering people to manage their own health and improve community health. Hesperian is most well known for their classic manual, Where There Is No Doctor, which is available in 80 languages and has helped millions of health workers around the world. So we asked Hesperian to distill the best content of the 3 country suites and to address any remaining gaps into 2 essential cancer education materials, one a patient and caregiver booklet, and one a health worker flip chart, which would be globally applicable in imagery and messaging, kept to a low literacy level, 5th or 6th grade, and affordable to reproduce because of simple imagery in black and white and because of formatting. So those are the images that you see here on the right. We're going to talk a lot more about them later today. But I'd also like to show you the arrow pointing back to the East Africa materials. In the past couple of years, we've done some updates to the East Africa materials. And with our new global materials, those actually inform some of the updates. So this continues to be an iterative process for our materials. Next slide, please. So this is just a brief timeline of the last 10 years. Just to say again, started in East Africa. For the last 4 years, we've been working on our global adaptation and expansion. And really, since 2022, when the first materials came out in English, that's when we launched the English materials. And then since 2023, we've been focusing on the translation into 6 languages. And now we're so excited today to launch these materials with all of you and hopefully get all of you involved in Equipped. Next slide, please. And before I hand it back to Jenna to go into the nitty gritty, I have some appreciation and heartfelt thank yous to extend to hopefully some of the folks on this call. First of all, I'd really like to recognize both our partners in the development and adaptation and illustrations, Hesperian Health Guides, as well as our translation partner, Context Global. Both teams have been really wonderful to work with. So thank you so much for your collaboration. I'd also like to recognize the Fantasy Fair community, which leads an annual event, an annual Relay for Life event, and the funds that were raised enabled us to produce those first set of materials in English. So thank you so much to the Fantasy Fair community. You're wonderful supporters, and we appreciate you. And finally, to these wonderful individuals on the right-hand side who enabled us to really vet the translations and ensure that they were accurate in the languages that we have translated. All of these are volunteers, have given freely of their time to make these resources the best that they can be. So thank you so much to all of you on the right-hand side. And with that, I'm going to hand it back to Jenna. And she's going to talk to you about the materials, and we really hope you find them useful in your setting. So thank you so much.
Thank you. Thank you, Christy, for that intro and the background on global patient education at ACS. It's great to see everybody's reactions as well, so thank you all. So now, what you've likely been waiting for, I'll give a brief overview of the global equipped resources that we're launching today. Next slide, please. So we have three components of the global equipped resources. We have first the educational materials, which are the patient and caregiver booklet, and then we have a health worker flip chart. And these materials were designed to be used with newly diagnosed patients and caregivers, particularly in LMICs, but we recognize they might also benefit other phases of the cancer journey and in other relevant settings. So the global materials are distinct from the ACS copyrighted country-specific East Africa materials, which we've created for use in Ethiopia, Kenya, and Uganda. And then we have a training curriculum for health workers, so they can effectively provide cancer education to patients and caregivers in their organizations. So we have two versions of these. The first one being the instructor-led training, and then a self-paced online course. And then finally, we have a technical resource to help global equipped champions deliver and manage that effective patient education in their respective organization or institution by using the global equipped resources. So as a reminder, these resources are ACS copyrighted, but the training materials can be modified in line with ACS terms and conditions. So the resources are free of charge to any approved organization that has signed the equipped licensing agreement. So an application process is required for an organization to gain access to the resources, and I'll explain this later. Next slide, please. So to begin, we have the patient and caregiver booklet, which we call Finding Your Way Through Cancer, Answers to Common Questions. And the content covers information on cancer basics, treatment modalities, their side effects and side effects management, information about living with cancer, including advice and ideas for taking care of oneself and how to talk to loved ones about one's cancer, as well as information about caring for someone with cancer, including how caregivers can support patients as well as care for themselves, and then additional resources online, as well as some other topics which you can see on the slide here. Next slide, please. So in the booklet, we use easy to understand language. Christy mentioned from 5th, 6th grade, the reading level. And then we also have simple imagery to get closer to meeting the needs of the population of our partners. And the partners who often have less formal education, less resources. They might be impacted by misinformation in their communities, and they're trying to seek appropriate and timely care. So the booklet, along with the flip chart, and I'll talk about that next, have been developed to be universal, or what we're calling globally diverse. So that organization in different countries can then use these in their settings. So both of these educational materials, they can be printed for distribution, or they can be shared digitally if financial resources for printing are limited. So in this slide, you can see, so the cover of the booklet is in color, and we've purposely designed that so that the interior pages and the back cover are in grayscale so that organizations can do some cost-effective printing on their side. And I believe Christy mentioned this earlier as well. Next slide, please. So then we have the health worker flip chart, which we call Finding Your Way Through Cancer, a flip chart for cancer education. And this was designed for health workers to use when educating patients and caregivers about cancer. So it covers much of the same content in the patient and caregiver booklet, and it's intended to be used as a companion resource to the booklet. So in an ideal setting, a health worker will deliver education using the flip chart first, and then it reinforces it by sharing a booklet with the patient or the family. And then the flip chart does guide health educators on how and when to communicate with cancer patients, caregivers, and then their families. Next slide, please. So like the booklet, we have easy to understand language and imagery in the flip chart, but distinct to the booklet, the flip chart cover and then those inside pages are all in color. So this design is intentional so that a flip chart can be printed on durable, heavyweight paper that can be laminated and then placed on a cardboard stand with coils at the tops so that the health educators can easily flip between pages. So what would be an initial cost for an organization would result in a long-lasting resource that can be reused over time. So the flip chart incorporates large illustrations on each page to display the patients, and then with talking points on the reverse page or the reverse side to help the health educator deliver effective cancer education. Next slide. So the booklet and flip chart, they were originally developed in English, but we do now have translations of these materials in Arabic, French, Indonesian, Portuguese with two variations, African and then Brazilian Portuguese, and then Spanish. So for the translations, and as Christy mentioned in our acknowledgements, we worked with a translation and design company. We also worked with partners to vet and finalize the translations. Thank you all for your contributions and support because we couldn't have done it without you. And so now, today we're now making these translated versions available to all our partners. Next slide, please. So these educational materials are copyrighted by ACS, once again, so they cannot be edited or translated by any other entity. But there is the option that partners may request for us at ACS to add their organizational logo to the back cover of the patient and caregiver booklet. So in this slide, I show the back cover of the booklet. So on the left is a screenshot of the section where we can add a logo. And then to the right is an example of organizational logos we added for two collaborating partners in Indonesia. So, and just so you're aware, ACS branding is found inside the front cover, discreetly placed there, and so it doesn't show on any of the exterior pages. Next slide. So moving on to the training curriculum, our second component, we call the training curriculum Training for Delivering Patient-Centered Cancer Education. It is designed to introduce the educational materials to clinical and community-based health workers who provide direct support to cancer patients, caregivers, and their families. And it also supports the development of skills, attitudes, and practices for effective communication. So like I said earlier, the training curriculum is made up of two versions, and we have 3 modules in each of the versions. So that's an instructor-led training and then the self-paced online training. Next slide, please. So the instructor-led training is best for teams that can meet together in person with a structured training support or existing facilitators. It can be used as is, in its current state, or customized to your organizational setting and needs in line with ACS terms and conditions, which includes co-branding and language translation. So you are aware, we do distribute this training resource to our approved partners in English only. So the format is a PowerPoint presentation with facilitator guidance included in the notes section of the slides. So from the images in this slide, and particularly on the right, you can see we've incorporated a say, do, ask approach, and that makes it easier for a local facilitator to deliver an engaging and effective training. Next slide, please. Okay, so the self-paced online training is best for organizations with limited staff time or no formal training personnel or a training program. So the training can be used, the training is available, ready to use as is. It cannot be customized because it's an online training, and it is available in English only. So on this slide, we have images of the different online features as well as what, the interface looks like. And some of the features include like options to listen to the content as an alternative to reading text. We also provide online activities and assessments for individual participants to engage with the content. Next slide, please. And then finally, for our technical resource, we have the Quick Start Guide for Global Equipped Champions, which has been developed as an online tool to support the organizational uptake of the equipped resources and then promote learning among staff within your respective organizations. So the primary audience is the equipped champion, which is someone that you as your organization would identify, and this person would play a key role in helping your organization deliver clear, compassionate, and then consistent cancer education for patients, caregivers, and their families. And so the objectives of the guide are to explain what equipped is and why it matters, identify the best training delivery pathway for your setting, select and prepare effective facilitators, and then develop a simple plan to deliver your trainings and cancer education. Next slide, please. So I can see that there's been some movement in the chat. I haven't been looking at it. And just as a reminder, we've covered a lot so far. So if you have any questions that you want covered, please post them in the Q&A. We'll come to them later in the session. Or if we can't come to all of them, we'll look to share an FAQ. So without further ado, I want to move into the exciting part of our session, which is our panel discussion. Next slide, please. Next slide. Oh, thank you. I can't see everybody on the screen right now, but can I please ask our panelists to come on camera if you haven't already? And I am very excited to welcome three of our longstanding partners in Kenya and Uganda who have been using the Kenya or Ugandan cancer education materials for patient and caregivers, or what we're also calling the CMPCs, in their particular settings. So as a reminder, the CMPCs are country-specific versions of the ACS Global Educational Materials that predate EQUIPPED, and they're currently being used in Ethiopia, Kenya, and Uganda. So I'll do a brief introduction of our panelists, and then we'll jump right into the discussion. So first, we have Gladys Nduku Mukosi. She is a dedicated palliative care specialist nurse and counseling psychologist at Kenyatta National Hospital, or KNH, in Kenya. She is a co-founder of the Oncology Nurses Society of Kenya, and she currently serves as a trustee. She is also the president of the Palliative Care Nurses Society of Kenya, which she established in 2023. So Gladys is a trained clinical navigator, and she is one of the pioneers of the patient navigation program at KNH in Nairobi. She has participated in developing, reviewing, and sensitizing health workers on the use of the Kenya CMPCs, and she is a facilitator for the health worker trainings on the educational materials. So a big welcome, Gladys. We then have Fatina or Tina Nakalembe, an oncology nurse and the head of the patient navigation services at the Uganda Cancer Institute, or UCI. She has a patient navigation certification and a bachelor's in nursing science. And the Ugandan CMPCs are used in the patient navigation program she manages at UCI. So a warm welcome to Tina. And then finally, last but not least, we have Charles Muya, a programs manager at the Kenyan Network of Cancer Organizations, also known as KENCO, where he leads the design and implementation of national cancer control initiatives, including advocacy, capacity building, and patient support programs. So since 2019, Charles has been a core technical contributor to the Kenya CMPC program, supporting its full cycle from the development to nationwide rollout. His contributions include coordinating and delivering training for healthcare workers, overseeing for printing and national distribution of the materials, monitoring uptake and use across healthcare facilities, and then supporting medical content review to ensure accuracy and clarity. He also played a key role in curriculum review and strengthening the quality, effectiveness, and relevance of cancer patient education in Kenya. And just for our audience sake, Kenko is the manager of the Kenya CMPCs, leading the coordination of the trainings and distribution of the materials to health institutions and cancer organizations across the country. So welcome, Charles, and welcome to all three of you as our panelists today. So I will jump right in with my first question for Gladys. So Gladys, you helped start the Kenyatta National Hospital, or KNH, Patient Navigation Program as one of the first clinical navigators focused on helping patients to understand their diagnosis and treatment plan. And then interestingly, the cancer education materials were launched in Kenya around the same time as the navigation program was started. So I'd like you to think back to the time before the educational materials were being used to give us a sense for the experience of newly diagnosed patients and their caregivers before education was prioritized. And so could you give us a little insight around that experience before you had your educational materials? And then on the flip side, if you can share what it was like once the materials were in use and navigators were trained. Over to you, Gladys.
Thank you very much, Gina. I'm very much privileged to be on board, and thank you, viewers. Just to go straight to the question, first I want to share the experience of how Kenyatta National Hospital was before the introduction of the cancer education materials. I would summarize it with one word by saying that it was real suffering for our cancer patients. Cancer patients were suffering even before the whole program of patient navigation was introduced in the hospital. So you could see patients who are going through treatment, cancer treatment, without knowing what they are suffering from, what they are going to go through during the treatment. That is if it is radiotherapy, chemotherapy, any form of cancer treatment. It was also not easy for them to understand if they get side effects, any likely side effect of the treatment. They were not understanding what all this was. And before we started the program, we had done a study, a survey, which showed that majority of patients delayed treatment. They were delaying to start, and also they were dropping, they were abandoning the treatment. So maybe they did not know what is the importance of that treatment. And if I get a side effect, they were feeling like this treatment is making me worse. They were not understanding everything. They did not know where to seek help because there was no one to tell them this is what you are going through. And many thought they better go for other options of treatment, like others would go to herbal treatment, others would go to seek for, maybe they thought it was witchcraft. So there was full of disorganization. I would say that it was there was no these booklets. The place was like a marketplace. That is also what I can say. The care was fragmented. You could see a patient from this corner, the other one from this corner, and it was not good for the patients. They were really suffering. So they had no information, as I have said. But when the booklet came and the program set in Kenyatta National Hospital, quality started straight away. There was a lot of order. If you could come after 3 months of the introduction of the material, you would see a big difference by seeing the way the patients are flowing. They are coming without fear, just to see, because just to be told, cancer treatment center, you are going there. That word was finishing them. But later they were able to come without fear. So there was order. There was that patient-centered care aspect. Patients were getting care, one-on-one care, and they are being told what it is, what is it, by using the material. As you can see my colleagues here, they are trying to explain what it is. What is cancer? It is not witchcraft. What is radiotherapy? It is not going to be banned, because most of the time, especially in my hospital in Kenya, there is no word. When we are talking in my local language, that is Kiswahili, there is no local word to mean radiotherapy. So we tell them they are going to be banned, just to paraphrase, and they fear and they go away. But now we were able to demystify that and tell them it is not going to be, you are not going to be banned. You are going to be put in a machine like the way you are put during a CT scan or an MRI, and it is going to kill the cancer cells, and we explain all that. So patients understood their disease, and they were able now to own it. And they were able to understand the treatment options and also the likely side effects. And we were telling them we are there for you, even during that, if the side effects occur. Otherwise, patients were given accurate and appropriate information using these materials, and they were really helpful even for the healthcare worker, because you go page by page. Because communication is also a very important element in this. You could have the material, but how to put the message across to the patient is also another thing. So they were able to control their journey or their trajectory journey of cancer care from the diagnosis to the end. And we saw now patients were not delaying treatment, patients were not abandoning because we follow them, and we give this booklet after every sitting. When they come from the doctor, especially the first visit, they go to the doctor, they are explained, this is what we are supposed to do. After the doctor, they come now to sit with the clinical navigators, the way you are seeing. And then we explain one by one. And now when they go, we are releasing them. We give them a piece of a booklet to go and continue reading at home. We tell them about nutrition. We tell them about taking a lot of fluid. We tell them about this is a disease like another. It is not a death sentence. So we demystify those misconceptions. So patients felt involved in their care, and they usually comment every time we sit with them. Sometimes they ask, hey, these things have really changed. Is this Kenyatta National Hospital? And others, when we give them the booklet, they ask, am I going to pay an extra coin? And we say, no, this is just, it is supported, it has been bought for you, and it is a support. So we did more surveys subsequent years, and there was a lot of improvement. You would see there is patient survival rate is increased. So it is a book which we cannot say it has not put an impact. It has really put an impact in our patients' lives. So I don't know whether I've answered everything.
Oh, yeah. You've
Thank
given
you
us
very much.
a wealth of information to kind of work off. And I just wanted to highlight one thing for our audience that you said. You talk about the patient flow, but then you also improved patient flow, but you also mentioned how these educational materials didn't only impact patients and their education and trust and confidence in the system, but it also impacted the health workers. And I think that's a really valuable point. So thank you, Gladys, for sharing that. I'll come back to you a bit later, but I'm going to move on to Tina now. So Tina, the question for you is, as the patient navigation program manager at UCI, I think we're all curious how similar your experience at UCI is compared to what Gladys has shared from KNH. And could you share some of your or your team's experiences using the Ugandan materials, and perhaps maybe just focus on what has been one main impact from your point of view to kind of make it more succinct. Thank you, Tina.
Hi, everyone. Thank you, Jenna. We launched the patient navigation program in February 2021. And ever since, we've been using the patient education materials. I was a clinical navigator for 4 years, and I've been heading the navigation program for 1 year now. I have an experience using these materials with the patient. When a patient is diagnosed with cancer, they all get overwhelmed with their family members. Those who can access internet, they go in and read all the information which is not necessary. Those who cannot access internet, they ask friends, they ask elders, and by the time they come to the Uganda Cancer Institute at the navigation unit, they have already information which has made them have a lot of fear. Knowledge is power. I have seen patients changing their attitudes towards cancer care, changing attitudes towards the diagnosis they have after giving them education during using these materials. When patients come at the reception, we give them education materials, each copy for caretakers. We give them each copy to share with the patient. This material does not only provide information, but it occupies the patient's mind instead of being worried and fearing. And when they come, they are shocked that there's already an initiative to put together all what is required with their information. When they are coming, they think it's too much that nobody can clearly understand what it is. But when you give them these materials, they start understanding, they start removing whatever they had in their minds about cancer. We move at the clerkship. Doctors utilize these materials to answer patients' questions. Will cancer cure? Why me? Then we go at the level of the clinical navigation. Because at the navigation unit, we do encounter 1, educating the patient his or her diagnosis. It is really hard for you to make a patient understand. And actually, it is very consuming. It looks like a classroom because you have to draw a cell and then you draw how it multiplies abnormally. But with the flip chart, the patient has their own copy. It's very easy for them to open and then you follow through. And patients think that now we are very ready to trust. Because once they see whatever we are talking is similar, is unified, it's already researched on and drawn down, it takes it very easy. In fact, during the navigation encounter 1, it becomes more interactive when you are with a patient. He has his own copy. You also have a material to use. Also, at the same time, we use the same material, the soft copy, to help educate them in groups in different waiting areas. We use these soft copy materials with the same content to educate patients in a large group, to make them understand about their diagnosis, to understand about their care processes, because before they come to UCI, it's already too much, and they think nobody can really answer this question. There has been a lot of impact using these materials. I will never forget when one time I was in radiotherapy as a clinical navigator, and a patient came in, see a cervix patient who was supposed to be given chemoradiation. And I explained to the patient that today we are going to book you, then you'll see the radio-oncologist in 2 to 3 days. I've actually booking her for 3 days, and then you shall start the journey of treatment. So, like Gladys has said, we have local translations about radiotherapy which do not match with the real treatment. So the patient looked up and is like, but electricity is on. Why don't you give me my electricity? I've been told that my disease is already in late stages. So I had to sit down and get a flip chart, use the diagram in the flip chart, which demonstrates what a radiotherapy looks like. And at the end of the discussion, the patient was happy. She now opened. She said that they had told her that they are going to give her electricity, and she was wondering how electricity is going to pass through her because she has seen people dying of electricity shocks. So there is a lot of impact if you're using the educational materials to educate patients on their diagnosis. Patients come when they have their own definitions of what is cancer, what is radiotherapy, what is chemotherapy, and some of them, or most of them, their answers are not the real understanding at all. Even at the cancer center here, you realize that some doctors at times they put hard words for patients, then other nurses will speak in another way. But when the material came on board, that all of us had to be trained about what is cancer. We have a unified and standardized way of delivering cancer information in a very precise, very simple, non-threatening way where patients can easily understand. It makes it very easy for caregiver to interact with the patient. In fact, you cannot do navigation services for clinical navigation activities, which is a GIST activity or a GIST model for patient navigation program without the education materials. It becomes very, 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 very hard. So it is a very fundamental tool for cancer care. It enhances adherence to treatment, and it is very useful. It saves time for caregivers. Thank you, Jenna.
That's wonderful. Thank you so much, Tina. And I also appreciate that you started explaining how you use those materials as well as the impact that it has had on your patient and caregiver education. So I'm going to move us swiftly into Charles. I did have a few other questions that I did want to answer our panelists, but in the interest of time, we might actually share these questions and responses with you after the session. So one further question, and this one's for Charles. So you've been leading the distribution of materials and training of health workers across Kenya since 2019 as a Kenko staff member, and this has been in partnership with the National Cancer Institute of Kenya as well as the Ministry of Health. And I must say this is a very commendable reach that you've all been able to implement. So I'd like for you I'd like to get your perspective on the training curriculum itself. Which for our audience in the Kenyan context is instructor-led. So can you briefly describe the skills that health workers gain and share, and share how the training has been received by health institutions and health workers? And can you also maybe tell us what have participants enjoyed the most about the training and why, and perhaps maybe one key enjoyment item? Thank you.
So thank you so much, Jenna, and the ACS team for inviting me and us as Kenko in this forum. Like has been mentioned, we've been leading the in-country dissemination of the Kenya CMPC since 2017. And our work includes training of healthcare workers using these materials, printing and distribution, and medical content review that we undertook a few years ago. And over the years, we've trained over 200 health workers in a training we did in 2019, another one we did in 2025, and another one we did in 2020 and 2024 virtually. And over the years, again, we've distributed over 90,000 patient booklets and 1,500 healthcare flip charts through the health workers that we've trained. So I will move quickly to your question regarding our experiences with the training. And the skills that we can highlight from the instructor-led training is that, first of all, our first module is cancer basics and cancer patient journey. And this equips health workers with a clear understanding of the cancer continuum from diagnosis, treatment, survivorship, palliative care, and the cancer patient needs across the continuum. So the health workers are able to be updated. For example, if there are new developments when it comes to any particular aspect, and also use this opportunity when we are covering this module to also highlight maybe recent policy stages, recent developments, so that the health workers are able to be updated. And this helps them to better orient patients and caregivers and manage patient experiences at every stage. Then another skill that is very important is communication skills. And this is, I would say, the most transformative module. And it points to a key gap in cancer patient education. And Gladys, my colleague here, can attest to this. It's one of the modules that health workers really speak good of. And then she has been leading that training on that module, and she can attest to that. So participants learn empathetic communication, breaking bad news, which is a key gap, and how to handle difficult conversations with patients. As you know, patients would come with every other difficult communication issues, and this module helps to prepare health workers to be able to communicate to patients empathetically. If I can quote the training assessment that we did pre and post test. To justify this, we found that the health workers' confidence in effectively communicating to patients increased from 64% to 94%, and in breaking bad news, 49% of the health workers that we trained were confident in breaking bad news pre-training, but post-training that increased to 94%, pointing to the impact that the training had on the health workers. Then another area that is really helpful to the health workers is how to use the cancer education materials themselves. And they learn how to integrate provider flip charts, patient booklets, and the visual tools provided in the education sessions with the health workers. And as you can see from the photos there, we have health workers practicing the use of the materials, practicing how to both the communication skills and how to effectively communicate to patients using the education materials. So this also has been a key area that we have seen health workers getting trained on and getting skills enhanced. Confidence, for example, in the use of the materials increased from 47% pre-training to 91% post-training. So that really demonstrates the impact that the training has had. So if I can address the second part of your question, how health facilitators and health workers have received the training, I think it has been exceptionally positive across board. We've had terms like the training is timely, the training is practical, the training has filled a real skills gap in patient communication. So the response has been very positive, and also the kind of engagement that we see during the sessions points to the kind of interest that these workers have on the training. Then also immediately after training, we distribute materials to the health workers, and we see a lot of demand for these materials, pointing that the health workers are now using the knowledge and the skills gained during the training. So what participants enjoy most from the training, of course, this module on communication skills, effective communication and breaking bad news has been consistently highlighted as the most impactful part of the curriculum. Actually, health workers say that maybe they have not formally been taught how to break bad news, yet they are required to do that on a day-to-day basis. And that is why this becomes a very important module. Then role plays and audio visuals that resonate deeply to the audience. In the effective communication module, there's a video that we normally use, and it resonates very well with the health workers. And then again, role plays using different real life scenarios really are some of the areas that the health workers enjoy most. Then the interactive nature of the training, it's as you can see from the pictures there, it's very interactive, from group discussions to role plays to the facilitator demonstrating how to use the material. So it's very interactive. Then the other bit is when we are doing the training, we cluster the training into regional groups. So we promote peer coordination at the regional level and peer learning. And we've seen discussions going beyond the training to also strengthening the referral systems. So I think that is what I could say for now in the interest of time, and thank you very much.
That's excellent. Thank you so much, Charles, for sharing that. And I think the fact that you emphasize the communications skills and that section of the training. So, it's not just about learning about the cancer information and how to deliver it, but how to improve on those communication skills as well. So thank you for that. And huge thank you to all three of our panelists. Please do stay on the line, because if we have time, we will slip into a very quick Q&A. And I will just move on to our next section in the interest of time. So thank you all again. Okay, so shifting gears, I'll now briefly take you through the application process. I see there's been some questions about this, and this is particularly for you to be able to gain access to the equipped resources. Next slide. So we do have 5 steps to completing this process. First, we invite you to complete the online Equipped overview. This is so you know what Equipped is, who it's for, what's included, and how to get involved. And then, as you're reviewing this overview, we do encourage you to discuss Equipped with those decision makers in your organization. And then before you complete the overview, there's an online interest form that we ask all interested organizations to complete, and that starts or jumpstarts that application process with ACS. And then while we're reviewing your interests, we might reach out to you for more information. We'll also do that due diligence from our side on your organization, which will effectively enable you to be a licensee so that you can use these resources for free. And then once your organization has been successfully vetted, we'll share a licensing agreement, the equipped guidelines for use, and then an online resource request form from your organization for your organization to complete. And then once we get that application completed, we'll fulfill your request with the equipped resources. Next slide, please. So this is just a quick overview of the overview. So it's an online space for you to learn about Equipped. It hosts sample copies to the booklet and the flip chart versions in all languages. You can decide from that content if Equipped is a good fit for your organization or setting. It also provides information on the process to apply for approval and then access to Equipped resources. Okay, next slide, please. Right. So to start the application process with ACS, we do, as I mentioned, we ask that you complete this online interest form. And this is particularly so that, we can capture information on organizational information, but then any questions related to what are your plans for your health education? How do you intend to use these equipped resources? So this interest form sits in the overview. So you have to go to the overview first in order to get to the form. And if you're not ready to apply immediately, you still need to have those discussions with your organization, with those key senior leaders. That is not a problem. You can always come back to this overview or the interest form. Next slide. Okay, so as I mentioned many times, because the equipped resources are ACS copyrighted, all organizations must sign a licensing agreement and then review those equipped user guidelines. And then once your organization is approved, then we'll share those educational materials, any training, and then technical assistance resources, including any co-branding of the materials as well. Next slide, please. So that's a whirlwind introduction to the application process and everything else. But given that we're at the end of the year and then the start of the new year, and there's a lot of holiday happening at this period, we do have a limited ACS team members in the coming weeks. ACS also closes from the 24th of December to the 2nd of January. Therefore, we will start reviewing any applications that come in on Monday, the 12th of January. So that gives you all the time to go into that overview, have those internal discussions with your organization and your decision makers, and then complete that interest form all by the 12th of January or later. All right, so I would like to hand it swiftly over to Christy to see if we have any questions. I know we're running out of time.
Yes.
Apologies.
Thanks, Jenna, and thanks, everybody. We do have some questions. I'm going to try to address a couple, but as a reminder, we will address questions in an FAQ along with the email that we send with the recording. So one of the first questions that came in is regarding language translations, and we expected this question. So, we're obviously excited to launch the 6 language versions today, but we also know that this may not yet meet all the needs that are out there. But for the time being, we do not have an immediate plan to do additional translations. However, we are very interested in hearing about the needs of our partners, both current and future potential partners. We want to see, first of all, who adopts the current suites of materials, and we really want to gain their feedback before we make further investments in translations. So Jenna mentioned the overview. That's going to be the first thing that you do after we get off this call. In that overview, if you determine that you cannot use the current materials as they are, there's a place for you to provide us feedback and any other comments that you want to make. And this information is going to be really valuable for us to assess if we can support further translations and to also help prioritize any other translations. So that was the first question I saw. And then we had another one. Okay, I think the question about Swahili has been addressed. Our Kenya materials do come in both English and Swahili. And at this point, we do not have a plan to adapt the global materials into Swahili. Okay, other questions. Are these materials easily adaptable to our unique settings? So, you can say this is maybe one of the strengths or the limitations of these materials. We purposefully focused on the most universal content in the most universal way that we can present it. in order to be able to make these materials available to many different institutions. So you're not going to see a lot of the particularities. We call these materials evergreen. They're really basic, simplified cancer information that shouldn't change anytime soon. If, however, your health workers or your facility has some specific information you need to share, you can do an insert. Your health worker, when they're doing that cancer information, if they want to, for instance, address very specific myths that are persistent in your communities around cancer, that's the opportunity that you have to bring to life some of the more locally relevant information to your patient population. But as we mentioned, these materials are not adaptable. And somebody also asked, do we have materials on specific cancers or on childhood cancers? And no, we do not, unfortunately. These really are focused on adult cancers, really the general information about cancer, not specific. There are other organizations out there that do that kind of work, and that's not what we're doing. So we wish we could do everything. I should say that. But for the time being, we're doing the best that we can with the resources that we have available. So let me see if there's any other questions. Oh, somebody asked about pain, as pain medications are not always readily available. That's another good example. The booklets do touch upon pain and other ways to address it, but we don't assume that pain medicines are available in a country, and that would be the kind of information that you would bring into the conversation. Because again, even though we're talking about materials, what we're really talking about is effective communication and those engagement between the provider and the patient, of which the materials support that. And hopefully you're not just distributing the booklet, but you're really having those meaningful conversations. Okay, let me see. Is there anything else? Okay, I think those are the main questions, Jenna. So let's move on and wrap up.
Great. And again, I want to thank all of our panelists who are here as well and who have contributed. So Andrew, if we could go back to the slides, please. And finalize. And I'm sorry we're over a bit, but we will finish in the next minute or so. Next slide, please. So I think somebody posted in the chat if we have, a link or anything for you to take that next step, if I read that correctly. So this is timely because I am encouraging all of you, if you're interested in these resources, please do take that next step and go into our overview. It has all the information you need in a really digestible format. So on this slide here, we've provided the link to that overview and also the QR code. So get your phones out, scan the QR code, snap it in, save it to your favorites or whatever, and you can always come back to it whenever you want to, or if you want to bring in people from your organization to see it as well. And just a little quick tip, I like to use it on my phone. All right, next slide, please. So as we said, and as our panelists discussed, we have country-specific educational materials. So for those, and these are the ones that predate our global resources, I must say. So this is our CMPCs in Ethiopia, Kenya, and Uganda. So for those of you who are joining us today from those 3 countries, please reach out to those local partners to access those country-specific resources if you are interested in gaining access to them, okay? All right, and then I will hand it back to Christy to take us to the last slide and wrap up. Thank you all for your time.
Thank you, Jenna. Great job. So a lot of you heard us talking about patient navigation throughout this presentation. Patient navigation and patient and caregiver education work hand in hand. We also have a patient navigation capacity development program. We are routinely welcoming in new organizations that are interested in learning about navigation and implementing navigation programs, whether you're a health facility or a cancer organization. So we just wanted to use this opportunity to let you know about that and invite you in if you're interested. This is the Beacon Initiative, which stands for Building Expertise, Advocacy, and Capacity for Oncology Navigation. And we'd like to encourage you to check out our introductory videos on our YouTube playlist, as well as visit our Beacon webpage. And if you have any questions, you can reach out to us at this email address below. But just to say, the resources we've shared today, whether or not you have a navigation program, patients deserve effective education and communication, and the materials and training stand alone outside of navigation. So don't feel that you have to have both, but if you want to have both, that just ups your ability to provide the best patient-centered experience that you can. So thank you so much. And with that, yes, thank you for joining us today. And we really look forward to connecting with all of you in the future, both those of you that we know and those of you that we don't know. Welcome to the Global Patient Support community. Thank you so much.
Thank you,
Have a great
everyone.
day.
Thank you.
Bye-bye.
Bye.